All right. What drug class is aspirin?
NSAID.
That was easy. That was an easy question. Good start. Good start. All right. So aspirin is an NSAID. Okay. Without looking at anything else, look at me. Give me things, the big giant things you know about NSAIDs.
Reduce fever.
All right. They're kidney toxic.
And ear toxic.
And they can be ear toxic. We just did a whole cheat sheet. So, okay. They can cause bleeding.
Take with food.
Take with food.
Because tear up stomach lining.
They tear up your stomach lining. What 3 patient population should never get NSAID? Asthma, CHF, COPD. Good, good, good. Can babies take it?
No.
Not until they're
Not until
6 months, or if it's aspirin, it's 18 years, right? Okay. It can increase your risk of 2 opposite things. Bleeding and clotting, like MI and stroke. What are some things you would tell your patient if they're on aspirin? You would say, do not do this.
No drink alcohol.
Don't drink alcohol.
Don't take it with warfarin.
Don't take it with warfarin, which is a anti-coag, okay.
Check the medication to see if if it interacts.
You can check for interaction, but it's not a P450, right?
Okay, yeah.
You want them to weigh themselves daily because it can cause fluid retention. Anything else? Well, let's find out, shall we? All right, aspirin is also called ASA because ASA is acetylsalicylic acid. Anytime you see a drug or any kind of formulation of anything that has salicylic acid, that's straight up aspirin. Okay. So and the reason why that's important for you to know, does anybody remember when you were little and you got a stomach upset and like your grandma or your mom was like, oh, here, have some Pepto-Bismol, the pink drink?
Yeah.
Okay, and they're like, oh, it'll coat your stomach. Well, they were giving this to all these kids. Y'all know that Pepto-Bismol is made out of aspirin?
Oh, wow.
Mm-hmm. And so all these kids were getting Rye syndrome. So now there is a new formulation of Pepto-Bismol just for children that does not have acetylsalicylic acid in it. Okay? All right, so MOA, make sure you have out your inflammatory sheet as well. Yes. Aspirin is a non-selective. Oh God, please, Lord, tell us what non-selective means.
It works on one area, but it doesn't work on the other.
All right, so non-selective means
it doesn't work.
No, it means like it works everywhere.
It works everywhere. So aspirin is a COX blocker. So if it's non-selective, it blocks COX 1 and 2. Okay. Now, please help us. It is also irreversible. What does irreversible mean?
Cannot turn back.
What does that mean?
Damage is done is done.
But what does that mean? What does this mean?
It means like your receptor gets...
It blows up the receptor, so it completely destroys all of your COX-1 and COX-2. So it will take some time for your body to remake the COX-1 and COX-2. Okay? Yes. It is a cyclooxygenase inhibitor. Look on your inflammatory sheet. Find, it's an enzyme. Find cyclooxygenase on your inflammatory sheet. Cyclooxygenase. Cyclooxygenase. Yes. So that is after arachidonic acid is produced, cyclooxygenase is produced. It is a cyclooxygenase inhibitor. So everything below cyclooxygenase on that page is going to be blocked. Okay. So it blocks COX-1, it blocks COX-2, it blocks thromboxane A2, it blocks prostaglandin. It's going to block everything below that. Do y'all see that? Yes. Okay. So if it blocks COX-2, that's why we're giving it, right? Mm-hmm. So that means that aspirin will decrease pain because it decreases prostaglandins. It will decrease temperature because it also decreases its fever. It's a fever reducer. It decreases inflammation, right? So that's because it's blocking COX-2. Now keep following down COX-2 and you'll see the platelet aggregation. So aspirin is also an antiplatelet aggregator. Okay? So let's talk about all the things that aspirin is. Okay. It is an antipyretic. What does antipyretic mean? It's a fever reducer. It is an antiplatelet aggregator. It is an anti-inflammatory. Yes? Yes. Okay. It is an analgesic. What's an analgesic?
Pain.
Decreases pain. You see all the things aspirin does because it blocks COX-2, right? Okay, yeah. But it also blocks COX-1, so we know it's going to tear up the stomach and mess with your kidneys. Because you see on COX-1, if you look on COX-1, renal homeostasis. Yes? Okay. So let's talk about who we use aspirin for. We use aspirin for dysmenorrhea. What's dysmenorrhea?
Low
Dys means what?
Like something's wrong.
Something is wrong. Meno. Period. Rhea. Leaking. So dysmenorrhea means very painful, heavy periods. Okay. Now, why would I use aspirin for that? Not necessarily heavy, but just painful. Maybe heavy too. Because it is a analgesic. So I'm going to go, every time I ask y'all something, you're going to go back to those words we already used. Aspirin is a analgesic, antipyretic, antiplatelet aggregator. It's an okay, you see what I'm saying? So we can match it up. All right. We can use aspirin for any type of inflammatory disorders.
Anti-inflammatory.
It's an anti-inflammatory, so we may use it like for RA. You may use it for anything that there's some kind of swelling.
Okay.
Now, here's the weird part. If patients are at risk of MI or a stroke, we put them on aspirin because we don't want their platelets to aggregate. But also remember, NSAIDs put you at risk of MI and stroke. Now, somebody make it make sense because I can't. Okay. Now they try to market aspirin as decreasing your risk of Alzheimer's.
The what?
They tried to market aspirin as decreasing your risk of Alzheimer's because it's an anti-inflammatory and they think that Alzheimer's is some kind of inflammation in the brain. But since we don't really know what causes Alzheimer's, I think that's false advertising, but that's just my opinion. All right, so drug classes. Here's talk about all the different things aspirin is. First of all, it's a salicylate because what's the actual name of aspirin? Acetylsalicylic acid. It is an antiplatelet aggregator. That's how it protects against MI and stroke. Okay? It is an NSAID. What does NSAID mean?
A non-steroidal anti-inflammatory.
All right, non-steroidal anti-inflammatory drug. That means it's not a corticosteroid,
No.
right? Okay. It's an analgesic, which means
Pain.
it relieves pain. It's an antipyretic,
Anti-
decreases fever. All right. There is some evidence that aspirin decreases the risk of, now some evidence is a joke, but here we are. Colon cancer, prostate cancer, ovarian cancer, and breast cancer. That's why they put everybody on it. Now, can I say, oh, breast cancer runs in my family. Can I just take an aspirin?
No.
No. Okay, but this is where we're at. Okay. So biggest side effects. Aspirin, of course, is going to cause GI upset because
It tears up the stomach.
it tears up the stomach because it blocks COX-1. Okay. Salicylism. Salicylism is when you start to get toxic on aspirin. The
Okay.
first sign and symptom is tinnitus. What's tinnitus?
Ringing of the ears.
Ringing of the ears. So if you have a patient on aspirin, all of a sudden they're like, oh, do y'all hear that? You better be like, oh shit. Okay, that's very, very bad. They start to sweat, they get a headache, they get dizzy. This is telling me, ooh, I better check that aspirin because I think I might have given them too much. All right. If we know it's hard on the kidneys, we also have to watch the ears because it's ototoxic.
Yes.
Aspirin causes fluid retention because aspirin is hard on the kidneys. Okay. Now, aspirin is albumin bound because what did we say albumin likes? Ass. And this drug is acetylsalicylic acid. Okay. So if it's albumin bound, then we have to watch their albumin levels, right? What happens if their albumin levels go too low?
They'll go, if it goes too high, it's toxic. Ineffective?
No.
Oh.
Albumin bound means
Yes.
albumin is attracted to that drug. That drug that
they'll
is
have a lot of free
attached to
drug.
it, they'll have a lot of free drug.
Right.
So if their albumin levels go too low, they can get toxic
Sick.
on aspirin, which
Okay.
will lead to
Salicylism.
salicylism. Okay, salicylism. Okay, so you really have to watch the albumin levels. What is a normal albumin level?
Albumin is 3.5 to 4.5.
3.5 to 4.5. Very good. All right, biggest adverse effects. A lot of people are allergic to aspirin, right? So you got to watch for hypersensitivity reactions. We know that NSAIDs cause bleeding. That's a given. So if the patient starts bruising more often, okay, or they start bleeding, that is a big concern. So because it can cause bleeding, we discontinue aspirin 1 week before surgery, unless it is a,
Emergency?
no ma'am.
Oh.
Unless it's which surgery?
Oh, it's a cabbage.
Unless
then
it's a
2 weeks.
cabbage
so
and
it's
then
2
it's
weeks.
2 weeks. Very good. Very good. All right. Aspirin can cause Rye syndrome in who?
In
Kids.
In children. So who do we not give aspirin to?
Children.
Under 18.
Under 18, because it can cause Rye syndrome, which affects their liver and brain, and it is not treatable. It's there's no
Life
specific
treatment.
no. It doesn't mean they will die. It just means we just have to do symptomatic care because there's no actual treatment for it. Do we understand?
Yes.
Especially if they have had chickenpox or flu recently, that puts them more at risk. All right, aspirin causes GI ulcers, bleeding, and perforation. How come?
Because
Tear up
it's hard
stomach.
on
It tears up the stomach because it blocks
One.
COX-1. Good. Who is most at risk for GI issues with aspirin? And the reason why you need to know this is because, like, I may not put somebody on the at-risk list on aspirin. Okay, if they're elderly, right? Because the stomach lining may already be affected.
Yeah.
Okay, if they have a history of peptic ulcer disease, and then you're putting acid
Yeah.
into the peptic ulcer disease.
Ugh.
If they're heavy smokers, because smoking is irritating to the stomach
Yes.
lining, right? If they're an alcoholic,
Irritates stomach.
it irritates the stomach lining. This patient probably going to bleed. If they have H. pylori, what is H. pylori?
It's an infection.
It's a massive infection in the
Stomach.
stomach. It's in the stomach, which can irritate the stomach lining, cause GI bleeding, and then you put aspirin on top of that. You want to put acid on a GI infection? I do not either. Okay. All right, toxicity is a very big deal with aspirin. You have people that will try to overdose and harm themselves with aspirin. This is a very bad way to go. This is horrifying, okay? So you do need to know your toxic levels because this is very, very important. So if somebody comes in and they have tried to overdose on aspirin, we will draw blood, okay? And over 200 in their blood is considered toxic. Over 400 is like, rest in peace, their kidneys, okay? So signs and symptoms that they might have aspirin toxicity, they're going to start out in acidosis because aspirin is acidic. Their body will try to compensate and they might end up in alkalosis. Okay. They're going to be hot and sweaty, dehydrated. They'll have massive tinnitus. They can get seizures and CNS depression and respiratory depression. Okay. This is very big, bad, and ugly and not an easy way to overdose. Okay. This is very bad. Not that there's an easy way. I didn't mean it ugly. Y'all know what I mean. There is no antidote.
Oh, wow.
So what do you think an aspirin toxicity would end up killing your patient? How would they die?
The fluid balance.
It's going to kill their kidneys,
Yes.
right? So first of
They'll
all,
go
since
into
they have
shock.
respiratory depression, they'll probably, they could go into shock, but it'll probably cause a massive AKI and kill their kidneys off, right? Or the acidosis could get you too, right? Because all your organs are sitting in acid. So first of all, we're going to vent that patient because they have respiratory depression.
Mm-hmm.
We're going to cool them down, okay? Because they're going to have massive hyperthermia.
Okay.
Now, how do you cool down a patient in the hospital? What do we do?
They
It's
have
not
like-
ice, but
No,
yeah.
they have like for the bed.
There's a cooling blanket that we'll put on.
Yeah.
We can do cool IV fluids. So you put the IV fluids that are in a refrigerator and you give them cool IV fluids. Okay. We'll put a fan on the patient. We'll decrease the temperature in the room. And then we try to get all the aspirin that they've taken out of their body. So any aspirin that's just sitting on their stomach, we want to get it out. Okay. So we will. Yes, you've heard of like stomach pumping or they had to pump their stomach. Well, this is how you do it. All right. So first what they do is, y'all know the difference between gavage and lavage. A gavage means you're giving. Gavage means you're giving something. Lavage means it's leaving. So you will put in a huge tube in their mouth. Giant tube, just okay. And we stick activated charcoal down in there. What is activated charcoal? It's a grayish black color, first of all.
Something that sucks out the toxicity.
It does.
of the body.
It absorbs anything that's in the stomach. So you're gonna gavage charcoal and let it sit and gather up all that aspirin. Then you're gonna do a gastric lavage and pump all of that out because it's already gathered up the aspirin.
Okay.
Now I got to worry about their kidneys, right? Yeah. So we are going to alkalinize the urine because how do you think these kidneys are going to feel peeing out that much acid? It's going to burn them and kill them. Yeah. So we alkalinize the urine, which means I'm going to give that patient bicarb IV. What is bicarb? A base. So we're going to make them more basic so that way when they pee, it won't be straight acid. Okay. And then they're probably going to need to go on dialysis because those kidneys are going to be shot for a period of time. Y'all with me?
Yes.
Okay. So for nursing care for aspirin, okay, we're going to recommend a PPI if they're like, oh, my stomach hurts. Okay. A PPI is a proton pump inhibitor. It ends in prozol and it decreases stomach acid. Okay. We're going to monitor labs. I'm going to give you labs. You're going to tell me why with aspirin I would monitor these. BUN, creatinine, GFR.
Your kidney.
It's kidney toxic. CBC.
Liver.
It's not that. No, liver's not in CBC.
No, but your blood. Your
Bleeding?
CBC, it's
bleeding. So I'm going to look at the H&H to see if they're bleeding. I'm going to draw their albumin levels because aspirin is albumin bound. Report black tarry stool or tinnitus. Black tarry stool could mean
upper GI bleed.
they've already got GI bleed. Tinnitus could tell me what does it tell me? They're already starting to get toxic in aspirin. Okay. If they're like, oh, I have to take this aspirin every day and it's just tearing up my stomach, we can order an enteric coated aspirin. What is enteric coated?
It means the
Protective for the stomach.
It comes with a protective coating around the aspirin and then it won't break down in the stomach. It'll break down in the small intestine. Very good. All right. Monitor for allergic reactions, of course, because a lot of people are allergic to aspirin. Watch for any signs of bleeding. Okay. Do not combine aspirin with. It has a do not combine list and y'all are going to tell me why. Do not give aspirin with anticoags. Bleeding. Do not give aspirin with corticosteroids.
Tear up stomach.
Tear up your stomach. Do not give aspirin with alcohol. Tear up stomach. Do not give aspirin with ibuprofen.
Same.
That's 2 NSAIDs, right? Do not give aspirin with any other kidney toxic drugs because you're going to ruin your kidneys. Yes. Please, Lord. Here we go. I believe in y'all. Do not give
With
aspirin with ACE inhibitors and ARBs.
They're
ACE
kidney
inhibitors and
drugs.
ARBs are kidney drugs and they make you pee.
Pee.
And aspirin is hard on the kidneys. So we're going to mess up their kidneys. Yes?
Yes.
All right. You have a do not give list for patients that already have certain disorders.
Yes.
So do not give aspirin to a patient with PUD.
Peptic ulcer disease.
Because
They already have the ulcers.
they already have
and they're
ulcers and then
making
you're giving them
them-
acid, basically. Okay. Do not give aspirin if a patient has a bleeding disorder.
More bleeding.
More bleeding. Do not give if they're allergic to it. That should be a
Yes.
given. Okay. Do not give if they're pregnant.
Yes.
Why
So
should
why
you not
not
give
give-
aspirin in pregnancy?
Because it could cause Bryce syndrome.
No.
Yes, it can in the baby,
Yeah.
but the baby wouldn't get it in utero.
The
But-
PDA.
But the
It can close the PDA
Yeah.
on the baby. Okay. Do not give to children.
Now
It can
we-
close the PDA. Okay. Do not give to patients with asthma or heart failure.
Yes.
Didn't we already talk about this?
Yes.
Fluid retention. Do not give aspirin to patients that are alcoholics. You're going to cause a stomach bleed. All right. Do we understand aspirin?
Yes.
Wait, didn't you say children?
Oh, and I like your bud, by the way.
Oh,